Our first guest is Dr. Sherbaz Bichu. He is the CEO at Aster Hospitals and Clinics in the UAE. And one of the things that we do want to talk about with the Dr. soon, Neil, is diabetes. We know that it was World Diabetes Day only a couple of months ago, and it really is a growing problem in the community.
Oh, well, yes. I mean, diabetes is, as I say, the silent killer. And within UAE, within India, we've seen so many of them, the numbers propping up. And it finally brings down to the same point of awareness. The more you make people aware, the more you can keep diabetes at bay.
He's joining us via Zoom, the CEO at Aster Hospitals and Clinics across the UAE, Dr. Sherbaz Bichu. Thank you very much for joining us this afternoon.
Thank you so much for having me. Thank you.
It's great to have you here. What is the impact of organising this diabetes screening camp? You're organising the largest diabetes screening camp in the Middle East by Aster volunteers for the workers' community. What is the impact of this?
So the basic reason for organizing such a campaign is to understand the depth and breadth of the diabetes among the community. It is one disease wherein people don't give so much of importance. Because there is no so much of importance on this, all these diabetes are detected very late. Once it's detected very late, there are a lot of other complications of diabetes which is coming in.
Mm-hmm. That's right. So, obviously complications come in, and diabetes, as they say, is the gateway of the trifecta of the heart, kidney, and obviously the diabetes itself. But, when you have a screening camp like this, what is the final outcome that you expect, as your objectives for the screening camp like this?
So if you look at Dubai, right, it's mainly an expat population which lives in Dubai than the inmates of Dubai, if I may call so. And then all of us, including all of us, right? We're busy working. We don't even have time for ourselves. So such diseases like diabetes, if not detected well, it will manifest as either a kidney failure or a optic neuritis, which affect your eyes. So such campaigns, when you look at it, and if we can identify it much earlier, it can be pinned out very early. And that can bring down the mortality and morbidity of the disease.
Yeah, it's an interesting one when we talk about diabetes, certainly amongst that expat workers community. Where is the location that this is going to be held, this screening camp?
The location was done in DIP, Dubai Industrial Park, wherein we had a large camp. All the workers were called, and it's giving back to the society also. It's a CSR responsibility for Aster to do that campaign in mass. So it's our things does not stop in just by detecting diabetes for them, right? We advise them. We give them a doctor's consultation, and based on that consultation, if their sugars are high, and if it's a population who cannot afford, we arrange fund either from our CSR bucket or from other voluntary NGO organization who can help them to come out of these diabetes.
And that's interesting that you say, that it's not just the screening of diabetes that you do, but you do an end-to-end kind of a solution for the people who come there at these camps. That's fantastic. But then, when you look at the demographics of UAE, and especially when you look at, these camps where you go out and do these diabetes screenings, does it have a higher skew of diabetes patients or the detection is higher in those demographic regions?
More than the density of diabetes in that region, right? It is this community which neglects diabetes and these chronic diseases, because there's nothing which is apparently there's no pain, there's nothing which is bothering them today.
Right.
Everything which is going to bother them for tomorrow and day after, which that part of working community is not aware of. Two, they're not bothered because they're busy with their day-to-day things.
True.
But then this is the only individual who is a breadwinner for a large community back in their homeland. So if we don't take care of them, taking care of them is equivalent to taking care of a community.
Fantastic.
So that's the reason why we chose going into that area.
When it comes down to diabetes and certainly diabetes awareness, what are some of the warning signs that people should look for if they think they may be pre-diabetic?
So one of the major things is your family history. Right? If you have a family history of diabetes mellitus, or it is mandated on all of them who has got a family history to regularly check. check both fasting blood sugar and HbA1c and make sure that that is within the normal limits. That's one. Second thing is the various signs like, increase in thirst and then frequency of urination. All these are the basic things which may point it out, right? It may be a diabetes or not, but it's very important for screening. And even if you don't know about your history, about your parents, right, whether they have diabetes or not, it's mandated to go for a preventive annual screening so that you understand what your health status is.
Now, most of us, I would say, who come in from the subcontinent, generally, if not directly the parents, but grandparents would be, somewhere affected with diabetes. And that is probably one of the reasons and, the thread that we all try to live in, trying to stay fit so that we can keep diabetes at bay. But apart from knowing the fact that, yes, there is a family history, what should one do? Yes, I'm doing my tests and everything, but what else can one do to keep diabetes at bay?
So one is, see, we are in a community world in which we consume tons and tons of sugar.
Oh,
if
yeah.
you really look at how much we all consume per day, and Dubai has really spoiled us, having all kinds of cuisines, right? And then this is something which, especially the pre-diabetic people, if you don't take care of this part of it, that'll really going to get you into trouble. And even once you're diagnosed to be a diabetic or pre-diabetics, just your medications will not help. A triangle of things. One, in terms of your medication. Second, in terms of regular exercises. And third is diet control. Only if this triangle is completely full, you can really attack a diabetes. Otherwise, if one is left behind, it will be always an incomplete treatment.
Yeah, Dr. Sherbaz, having experienced a couple of Diwalis in and around here at Talk 100.3, I think I'm pre-diabetic. I mean, the amount of sweets that go on, it's insane what happens. And the ghee, I'm like, I say to Neil, how's everyone not got some sort of sugar resilience problem?
No, see, the idea is that we go out and work out.
Okay.
Right? We train, we eat good food. And see, listen, it's like Diwali, you should sometimes enjoy. You shouldn't really, curb yourself from celebrating Diwali. Am I right, Dr. Sherbaz?
100%. It's not about it's about the quality. You should have everything within the limits, right? The issue with all of us is sometimes we go full bam boom, right? Instead of one laddu, we end up ending up in 3 and 4.
Well, I know we do that. We do that. We go to a Dubai buffet and you think, well, it'd be rude not to sample and go back up. They've laid out all the sweets for us. It'd be, it's just going to go to waste. On a serious note, Dr. Sherbaz, if anyone is looking at getting involved in some of these screening camps, how can they find out more information?
So we have Aster Volunteers wing. So you can log on to Aster Volunteers and then get the more details about it.
No, that's fantastic, and I'm sure that with this initiative there will be a lot of prevention that'll happen. And like you mentioned, that you're not just supporting the individual who's working here, but you're helping and supporting the entire family and the community that's behind him, as he or she would be the sole working member and earning member for the family. I think that itself is a fantastic thought to initiate this program.
Thank you. So I think we need support from people, especially the Aster Volunteers wing. It is not only just on diabetes, right? We involve a lot of other volunteering activities. Mm-hmm. There are a lot of the Aster Volunteers is there into helping people who does not have a real family support, right, like what we have back in India. So there is an application for Aster Volunteers. You can be an Aster Volunteers and you can spare your free time for volunteering.
No, that's amazing. Isn't it?
So anyone can get involved. So if you go to astervolunteers.com, you can become a volunteer as well.
Yes, absolutely.
All right. Well, that website again is astervolunteers.com. It's a great way to, give back and surround yourself with other great people and know that you're actually making a difference and help making a change. So, Doctor, we do thank you for your time this afternoon discussing the importance of diabetes, and congratulations on you and all of the work at the Aster Hospital and clinics in regards to the diabetes screening camps.
Thank you.